Hi everybody, this is Abnormal Psychology. We're looking at assessment. This is the final video. So now we're going to look at another way to assess that you have nothing to do with except to recommend it, and that's a physical exam. When someone presents with something that you think might have some physical connection, we might recommend a physical exam. 60% found by research of psychiatric patients also have an associated physical disorder. So sometimes we have to rule out something physical. I saw a patient once with blue arcuate shades in their fingernails and flecks in their pupils, metallic flecks. And I hadn't remembered what that was. I ran across it years ago or something, and it didn't ring any bells when I saw it, but I thought it was unusual enough. Turns out the person depression was related to what's called Wilson's disease, which is a person who's missing an enzyme that gets rid of excessive copper in their bodies. She didn't have that, was building up copper in various organs, and one of the symptoms of that is difficult depression. So psychological symptoms can sometimes suggest that a physical examination is needed. Sometimes, not always. Okay. Then let's talk about neuroimaging and some related topics. So neuroimaging means looking at brain structure and looking at brain function. When you're looking at brain structure, you might be looking at the electroencephalogram, the EEG, or the computerized tomography, CT. Now, CAT scan, refers to computerized axial tomography. Or you could be looking at MRI, magnetic resonance imaging. Okay? These can be used, particularly the MRI, can be used to look at, suspect stroke, suspect tumors. An EEG can even sort of suggest the tumor. Can't see it per se, not visually, as a CT and MRI could. And MRIs can see finer structures than a CT can. Then you can look at the brain function, and one of those is a PET scan, a PET scan, which is positron emission tomography, or a functional magnetic resonance imaging, which is fMRI. And those are watching the brain in action. Okay, so let's talk about some of these individually. An EEG measures electrical activity of the brain, where they are, either alert or sleeping or relaxed or dreaming. And so they can measure the brain activity of various parts of your brain as you're doing something. You can ask someone to do something, look at pictures or whatever. And so it measures that. You can look for epilepsy and certain sleep disorders, and some brain tumors, as I said, may be shown, would be indicated, not shown, okay? A CT scan sees X-ray slices, so the computer can assemble and reassemble in any way you want it to, and it can rule out tumors, traumatic brain hemorrhaging or hemorrhaging by itself without impact. It usually or can be ordered before you would be recommended to get ECT. Yeah. And then the MRI and the fMRI, they produce very high resolution photographs, and they can diagnose very finely visible disorders like fiber disease, neurofiber disease. They can see certain brain tumors that CTs can't see. The fMRI can see processing of information and what's lighting up and what's not. That's used for assessment, but also research. A PET scan, positron emission tomography, looks at brain activity levels and can show very specific activities. So it's used more for research, but more and more it's coming into play as a way to use it practically, and it is often combined with MRI or fMRI to show tumors and their over time relative metabolism, for example. The last thing is neurological assessment. Neurological assessment is, as I mentioned once briefly before, an evaluation of cognitive function, and it can detect in a very sophisticated way using many different subtests, including IQ and all sorts of other things. It can actually suggest if there is a impairment in the brain and where it might be. So it measures speech, and it measures perception and sensory motor functions and all sorts of things. And it's often combined with other measures, including, as I said, the IQ. Requires 3/4 of a day, so that's 6 to 8 hours to administer, quite a bit of time to assess all the information and write a report. It's used for diagnosis, for forensic evaluations, for litigation purposes, and for some jobs. Maybe independent living, for someone with known psychological impairment, certain jobs, so forth. So how's that? Assessment. See you on the flip side. Bye.